Hello, my name is Tara Williams, and after watching my mom struggle for a year and a half to find a diagnosis, I realized there was something more I could do to help. In 2015, Superior Mesenteric Artery Syndrome Research Awareness and Support, or better known as SMAS Patient Assistance, was originated. The nonprofit assists those fighting SMAS with medical bills, expenses, and travel costs related to SMAS. So what is superior mesenteric artery syndrome? The easy way to describe it is that there is a portion of your small intestines and it becomes squished between the superior mesenteric artery and the aorta, which does not allow the passage of food or liquids due to the loss of the mesenteric fat pad.
Here is an image showing a patient suffering from superior mesenteric artery syndrome. As you can see, the aorta is the red line, the SMA artery is the blue, and the purple line represents the duodenum, or the small intestines. And in a normal person, this area should be much larger instead of being compressed.
SMAS can develop from severe trauma, scoliosis corrective surgery, drastic weight loss, though this is not always the case, burns, cerebral palsy, high insertion of the ligament of Treitz, or low insertion of the SMA artery. Again, I want to emphasize that this is not always an eating disorder and it is not self-inflicted. Suggesting that someone just eat more will not fix this problem. There's an estimated 41,000 to 96,000 Americans in the U.S. fighting SMAS, but this number could actually be much higher due to lack of research. And the most recent research only says that there's 500 cases, and this is from like 20 plus years. So again, the 500 number is invalid. There's closer to 41,000 to 96,000 Americans fighting this syndrome. These are our brave fighters who are willing to show the world their faces.
Hi, my name is Michelle. My daughter Alicia had superior mesenteric artery syndrome. She was sick for 5 years. She was 16 when she got sick, and she was very active and cheerleading, soccer, very active in her life, and was going to school and to college. And then she got sick and had to fight with her doctors. We spent the first 2 years of her illness fighting with doctors, trying to get them to understand that she was not doing this to herself. Those 2 years were precious days, hours lost that we can't get back. They set the tone for the rest of her treatment. This is why it's important to get diagnosed early and find doctors who know what they're talking about. We went from SMAS is not real and I don't believe in it to having surgery for it 5 days later. But by the time she had surgery, it was too late. So many other comorbid conditions had already set in. Malabsorption. Her gastroparesis was horrible. Her reflux was so severe. She couldn't even have anything go down all the way to her stomach before it was already coming back up. My child spent 10 hours a day in the bathroom just being sick because she couldn't keep anything down. She fought for 5 long years. This is why we need awareness. This is why we wear purple. This is why the nonprofit is there. We are asking everybody to please support SMAS Day, support the nonprofit, help us get awareness out. There are too many lives that depend on it. Nobody should have to go from 124 pounds one day, laying on their deathbed 65 pounds later. So this is why we need to find doctors that can diagnose quickly and patients that advocate for themselves and respond quickly when treatments are not working. This is why I hang around the groups and keep trying to help others, because I don't want anyone else to have to come and visit their child here. This is how and where I visit my child. This is what the nonprofit is for. And this is why we keep fighting for superior mesenteric artery syndrome awareness for. Alicia and so many others lost their lives just because there's not enough awareness out and people to help treat it and fight it. This is why we wear purple today.
These are photos of my son JT. JT was born with cerebral palsy. This is the frame his Nana bought for all the grandkids. You can see his kindergarten picture in the center. He always loved school. And you can see at the very top is his first grade picture, then his second, his third, his fourth, and his fifth. His sixth grade picture is missing, because this was the year that he was first diagnosed with SMAS. He missed picture day that year, along with a lot of other days. Well, the doctors disagreed and agreed and then disagreed about SMAS. 7th grade went much better, as you can see with this 7th grade photo. But every time he got sick with a cold or a stomach bug, his SMAS would kick in. 8th grade was his worst year. As again you can see, no photo. He spent months in the hospital, as did I with him. He missed most of that school year. We were given the choice of a spinal procedure or an abdominal procedure. We chose the abdominal procedure, which was to move his digestive tract around to unblock his organs so that food could pass through. I thought seeing him after that surgery was the worst day of his and my life. It was a long and very difficult recovery. But He started ninth grade and seemed better than ever. Ninth grade was the last school photo we ever got, as he passed away a month after school ended that year. This frame hangs in my family room, and it's still very difficult for me to look at. I see the empty spaces and remember his pain. Then I see a life cut way too short. I will never have a photo of his sophomore year, his junior year, or his senior year. I miss my boy so much every single day.
Hello, my name is Stacy, and I'm also a face of SMAS. Earlier, you heard my daughter Tara talk about our nonprofit. For those needing financial assistance, we encourage you to fill out and submit an application.
To apply for a grant, go to www.smasyndrome.org/grants. They can be mailed to SMAS Patient Assistance, Attention Grants, P.O. Box 555, Bonham, Texas 75418.
Please consider donating to our worthy cause. As you see, there are so many brave faces shown here, but not everyone has survived. There are parents grieving, siblings who miss their brothers or sisters, friends who don't have their bestie to call and chat with any longer. SMAS doesn't care how old you are, rich or poor, married, single, mother or father, or someone's child. Anyone can be affected. Please remember our faces. Thank you.